early intervention is a key component of the Headspace model, as Headspace is a predominantly an early intervention service, particularly for our priority groups who may be less likely to access help. It's important that we get to those people first. How does your centre and your clinical pathway achieve this early intervention model?
It's critical. It's critical to what Headspace does, and it's what Headspace does differently to, say, state mental health services, where you maybe have to get to this point here to be sick enough to access the service. I guess we do that through having an assessment process that meets the young person where they're at. Yeah, we don't go in with a set of assumed beliefs around how unwell a young person might be, or thinking, the issue you're going through really isn't that bad when you compare it to this person, because for that young person, it is their life. But having different ways of engaging and asking the young person and also the people around them, their family, what's going on for them, thinking about what the own strengths that they have, so being really strengths-based in your approach is really important as well. And then providing some education to young people and their families so they know what's going on, and they can help put what they're experiencing into context as well.
Yep. James, yep.
I want to talk about maybe the actual concept of early intervention and what is early intervention. So one centre, it could look like a 12-year-old coming in, accessing the centre, seeing a youth access clinician for 1 or 2 sessions, or it could be a 21-year-old coming to the centre, had psychological support historically, yet embracing services and a bit more trauma history, etc. So for me, I think it's ever changing, and for centres in metropolitan and non-metropolitan areas, I think we've really got to make use of online resources. The demand is not slowing, and we've got to acknowledge that, because Headspace is getting a beautiful popular name throughout the country. More people are seeing mental health as it's okay to ask for help, so again reducing stigma, so therefore we're going to see this continuous demand all the time. So irrespective of the resources that are coming out, the online resources, help being provided, I think we're still going to have this constant demand, and we've got to, as centres and centre managers, our role has got to think about how can we best support the young people who fit the bracket of what Headspace is aiming for. So mild to moderate, again, what is mild to moderate? It could mean different terminology amongst various centre managers and various centres, various lead agencies. For us, we're in a local health district, so we have beautiful partners with our tertiary mental health services, and I guess maybe threshold may be a bit higher, but I think that's consistent throughout many of the centres in our network. And it's given the clinicians permission not to see every young person just because they've made a referral or there's been a referral made, and having some faith in evidence-based programmes first, and if they don't work, inviting the young person back to the centre for a conversation and maybe a re-referral to the GP for a mental health care plan and referral, etc. So I think it needs constantly to be talked about. It needs constant attention, and again, through your activity reporting, the data we get from the HAPPY system, it's something that it's ever changing. So, and we have to change how we work on a frequent basis, I think, just to meet the demands.
Nikki, what priority groups does your centre see, and how do you engage with them?
Yeah, sure. We see different priority groups. One of the key cohorts would be Aboriginal and Torres Strait Islander young people and their families. So engagement has been a long and rewarding process. However, there have been challenges along the way, and I guess it's about linking back to the community engagement plan and having a look at the community's needs and listening to what works for them. What we have found is that the Headspace model has been great, servicing young people, but there was also flexibility to adapt it to the cultural needs of some cohorts. So for our local Aboriginal young people, they were saying that, you know, if we're going to come into the centre, we kind of want to see somebody face to face then and there. Previously, we didn't have that structure set up. There was a bit of a wait time, but now we have a priority fast tracking system where we make sure a youth access worker can come out, or a staff member or the manager, to provide them with a tour of the building, a bit of a meet and greet, and book them in then and there. So yeah, that's worked quite well. And also really listening to the elders within the community. We have been able to develop an Aboriginal reference group, which meets on a regular basis. So our Aboriginal and Torres Strait Islander reference group has been quite pivotal with our connection to community and really improving access rates, engagement, but also the quality of service. It's really important that we recruit staff who are on board, who are willing to learn, who are able to engage in, you know, cultural practices and competencies, and really understand the privilege that we're in when working with young people who may have a different worldview to a Western framework.
Yeah. We've done quite a bit to engage with young people of diverse gender and sexuality, both people who identify as not straight, but also people who identify as non-binary in terms of their gender, and also some young people who've wanted to go through gender affirmation processes as well. Albany hasn't had much in the way of a public LGBTI community, and we know that from staff members on our team. So we've actually established an LGBTI support / social group, and talking to them, we know that young people, and from our stats, we know that young people who identify as not straight are really comfortable coming to Headspace for support in Albany. What they don't have though is a social outlet, or a place to just feel like they have a sense of belonging. So we've done that to set up that group. I guess the other thing about gender affirmation was that young people previously in Albany used to have to travel up to Perth to seek specialist support there. And we had a young person engage with Headspace right at the time when the state service said, actually, we're a bit too busy, we're going to close our books. So actually talking to those services and talking to GPs and staff, luckily we've been able to organise some local training. So what that's actually meant is that young people have been able to go through gender affirmation, being supported by Headspace Albany, and that the clinicians have been able to seek support through specialist services in Perth. But a lot of that dislocation through having to travel up to Perth or back to access services has been reduced, or in some cases eliminated, which is great.